Basha, so I'm going to let Basha's social worker, Nicole, introduce.
Hi, everyone. I'm Nicole Sagman. I am the social worker at Basha High School. Thank you all for tuning in tonight. Tonight, our speaker is Megan Mims. She's from Copper Springs Mental Health Facility, and she's going to talk about understanding and supporting your child's mental health and when to reach out for help. So I'm going to pass it over to Megan.
Hi, everybody. My name is Megan Mims. Thank you, Nicole, for the introduction. I am a licensed master social worker, a certified clinical trauma professional, and a certified standard school social worker. So that's what all of those letters after my name represent. But as Nicole mentioned, I am the adolescent IOP therapist for Copper Springs, which is a mental health facility. We have 2 locations in Avondale and 1 in Gilbert. So this is just a little agenda for this evening. We're going to go over a couple of these different topics. What is mental health? Signs and symptoms of different mental illnesses, common mental illnesses, and then when to reach out, as well as how to support your children and what kinds of treatment we use at Copper Springs for the adolescent program. So since most of the mental health conditions can be intangible or invisible, it's hard to sometimes differentiate between thoughts, feelings, and behaviors that could be of concern that would warrant professional intervention and those that could be typical of adolescent behaviors. And so just as a disclaimer, this presentation is not exhaustive and does not include every possible healthy marker or possible sign of concern. And a lot of the references, as far as the statistics and things like that I've used came from the Youth Mental Health Project. So I would also encourage all of you to check that out if you have an opportunity to do so. So what is mental health? Some of you might be thinking in general, mental health sometimes gets linked with mental illness or a mental health condition, but when we're talking about mental health, every person has mental health, the same as every person has physical health. So in regards to these statistics, these are specific more to mental illnesses. But so in the bubbles here, suicide is the second leading cause of death in children ages 10 to 24. And some other examples of some research that has recently been done are starting to validate that depression can be seen in children as young as 4 years old. Some of you might know and may not know that anxiety is the most common mental health disorder in the United States. And mental health conditions are more common than heart disease, lung disease, and cancer combined. So it's really unfortunate. A lot of times there's a stigma around mental health and mental illness, but it's actually something we should be talking about frequently because it's something that's really common. And then this last bubble says 1 in 5 children in the United States has a diagnosable mental health condition, yet less than 20% receive the treatment that they need. And actually there's a significant number of years that tend to go unreported or untreated from when first symptoms present themselves. And we'll talk a little more about that later. So I just mentioned a little bit of this, but mental health includes all states of health, and it describes a person's state of emotional, psychological, and social well-being. So we know that mental health can impact the way that somebody thinks, feels, and behaves. And as I said in my disclaimer, not all mental health struggles can lead to a clinical diagnosis by a mental health professional. But this doesn't mean that children or adults even couldn't benefit from seeking treatment or help. And in fact, we'll talk about this as well in the treatment part, but one of the main initial steps is doing a comprehensive assessment to determine whether or not treatment could be beneficial. And so early intervention really is important to help adolescents and adults or anybody seeking treatment learn coping and adaptive skills so that they can thrive. So
Megan, I'm sorry, if you can just kind of speak up a little bit more. I still have them saying they can't hear, so just.
Yes, I will try my best to project.
Thank you.
No problem. And so in this last bullet point here, I talk about if a child had a sore throat or a broken bone, parents don't hesitate to seek treatment. And actually, I'm going to move some of these papers. They might be blocking my speaker. I'm wondering if that could be better. So this is the same approach we should take whenever we're having mental health struggles arise. It should not be stigmatized to seek assessment or to seek treatment from a mental health professional. The same as we should not hesitate to seek physical treatment if we have a physical illness. So as I mentioned earlier, sometimes mental illnesses, rather, that's a typo on my end, is often invisible. And so it can be hard to recognize when children are struggling. So these are some things to consider when you're trying to determine whether you want to seek consultation or assessment with a mental health professional. So one of the things I would encourage you to keep track of is the intensity. So how intense are the child or adolescent's behaviors, their thoughts or emotions? We really like to use rating scales as mental health professionals. So I would even encourage you to go as far to say if you had to rate the intensity of the behavior or of the thought or emotion on a 1 to 10 scale, what would that look like? What would a 1 look like? A 5, a 10? Another thing to consider is the frequency of the behaviors or the thoughts or emotions. So how often does your child feel or behave this way? Is it something that you've noticed a pattern? Is it something that's isolated or situational? Duration is another factor you want to be considering as far as how long do these episodes or behaviors last? And also, if it's a period of time, how long have you been struggling with these things? So oftentimes those are some questions that are asked during the assessment is for how long have you been feeling this way, or how often have you been dealing with this concern? And so these are intensity, frequency, and duration are really good ways to try and track different symptoms or concerns. So I often encourage caregivers and parents to keep a journal if they're just starting to see things and they want to keep track to determine further whether they need to seek additional help. But it also could be helpful when you meet with a mental health professional to provide some of this information to get a better picture of what's going on, because as parents, you know your children best. And then that's supposed to say functionality. So above all else, how well is your child functioning in life? Are these behaviors or thoughts or emotions impacting their social skills, their academic behaviors or performance, and then their activities of daily living? So are their activities of daily living impaired in any way? So these are just things to consider. And I know some of you might have questions about these, and so I will also just encourage you all to write some questions down as I go through the presentation, because we will definitely have time at the end. I'll be tracking myself to make sure that we have about 15 minutes or so for questions. So here are some signs and symptoms, and we know that throughout all life, people experience fluctuations. We go through changes. We have different situations that sometimes can impact us in certain ways. And so the thing to keep in mind is this is particularly true during childhood and adolescence, because this is actually one of the fastest growing times in development. In fact, the only other time that's really fast with development is birth to 3 years. So the adolescent time period is pretty significant as far as growing, developing, and determining whether or not certain behaviors can be considered healthy or typical, or if they could be risky or possibly concerning and relative to maybe a mental health illness. So in this big navy bubble, these are some healthy and typical adolescent developmental things. So I don't want to necessarily read all of these to you, because hopefully you can see them if they're not too small, but I'll just pull from a couple of them. So one thing that's pretty common, and a lot of times I hear from parents that they feel concerned about, is that friend groups tend to take the place of family, and adolescents tend to take initiative to separate from their parents. This is a typical adolescent behavior, and most teenagers want to be able to become more independent and self-focused. They really are connected to their peer groups, and this is a pretty healthy behavior in developing. Another thing that I hear a lot about too is maybe increased self-consciousness. We get this a lot, especially with parents who might be concerned given the increase in social media activity now that our teens are using. And so it definitely can be cause for concern, but I would encourage you to think about those factors on the previous slide, the intensity, frequency, duration of how maybe consuming thoughts are about their self-consciousness or self-esteem or self-worth, because to some degree going through adolescence, most of us maybe have experienced an awkward phase or a time in our adolescent development where we didn't feel as confident. And so those are two of the ones that I get questions about a lot. Some other ones on here: become argumentative and opinionated, or increased moodiness. We know hormones are raging during adolescent development as well. So all of those things could be considered healthy and typical behaviors or signs and symptoms. Some risky behaviors, and I say this because this isn't something I want to tread lightly with the words that I choose, but some adolescents do choose to engage in risky behaviors. What we do know about brain development is that our brain is not fully developed until our mid-20s, and the last part of our brain to develop, frontal lobe, which controls our executive functioning, our problem solving, our rational thinking, our impulse control. And so knowing that, it can be typical for some adolescents to engage in risky behaviors or risky decision making. This can be dependent on a lot of things. If they have a peer group that they feel pressured by to do things, some risky behaviors that they could be experimenting with or engaging in could be things like substance, and this should say use, I'm sorry about the typos, or sexual promiscuity. They could also have a lot of internet or gaming behaviors, and maybe even self-destructive behaviors, things like having poor friend groups. But they're risky because, again, if you start to notice these as a pattern of behaviors, or they're substantially or significantly impacting other areas, they may be cause for concern and need further assessment or monitoring to determine if it's something more going on. And of course, especially the more risky behaviors, again, earlier intervention is better. So it's nice to err on the side of caution.
Hey, Megan, sorry to interrupt again. I have a couple parents saying they can't see the screen very well. Is there any way you can take it off the presentation mode and make it into the full slideshow? It's on presentation where we can see like the next slide, so it's not on the full view. If not, don't worry. I just wanted to mention that if you can.
Yeah, I didn't realize it looked like that. On my screen, it is the full screen. So let me see if I can figure out how to do that. Whoops. Okay, give me 1 second. I'm so sorry.
Someone said switch screen using the display settings at the top of the window.
Let me go back to present now, because you all cannot see my screen currently, correct?
Correct.
Oh, now it's not letting me hit the present button. There we go. Okay, let me see from beginning. Oh no, whoops, did not mean to do that. Current slide. Okay, so someone said here in the display settings, is that what they were saying?
Yeah, that button, swap presenter.
There we go. Now can you see the full screen?
It's beautiful, Megan. Perfect.
Woo! Okay, thank you. I probably should have prefaced by saying I've never used Google Meet, so I'm learning. So any feedback with technology is welcome. So hopefully now you can see the full screen. Okay, awesome. Thank you to whoever pointed that out. Sorry that this whole time we've been on the other view. So if you need for me to go back at the end for any of those other slides, let me know and I'm happy to do so. I will give it just a minute or so on this screen in case anybody is still reading through it or wants to take notes. Also, I don't have an issue with you all sharing this PowerPoint if that's something that could be helpful. That's totally up to you all.
Yeah, we'll definitely share it and email it out to all families. So no worries with that.
Okay, then I am going to go ahead and move ahead. So again, these are kind of healthy development markers, but could also be risky behaviors that can be typical, but could also be cause for concern and need for further assessment. So I just want to be clear about that. I'm in no way suggesting that all teens are going to engage in all of these risky behaviors. It's just that we do know with adolescent development, some teens choose to engage in risky behaviors, such as those that are in this little bubble. Okay, so continuing with signs and symptoms, some signs for concern and further assessment. I know these are kind of at the bottom, but I want to draw your eye actually to the ones that are in red, specifically because these are significant concerning symptoms that can be life-threatening. And so these are things that I most certainly would encourage you to not wait on, not try to monitor further, and to seek professional help. So the first in red says binging and purging. So that would that could suggest that the adolescent or child is having difficulty with disordered eating or an eating disorder. So binging is when they feel they have a loss of control and overeat. So this is separate from something like emotional eating, because to be honest, I don't know about you, but at times I might emotionally eat some chocolate. And so this is something that truly is where they feel they have a loss of control. I've had patients and families that have shared they've had to have drastic measures where they have to make sure they're watching their adolescent or child when they're eating to kind of encourage healthy eating. And then purging, of course, is vomiting intentionally to get rid of any of their intake. Self-harm, the first thing that comes to a lot of people's mind when talking about self-harm is cutting. One thing that I think is helpful to know is that there is a difference, and this is not something that I would expect for parents or any person who's not in the mental health field to know offhand, but there is something called non-suicidal self-injury or self-harm, and then suicidal self-harm or self-injury. And of course, the difference is the intent behind the behavior. So what we do know about behaviors is that all behaviors have a purpose, even self-harm. And so it's sometimes helpful for a mental health professional to be able to assess further if a child or adolescent is engaging in self-harm, what the purpose of that behavior is. Is there an intent to harm themselves or to kill themselves, and it's a suicidal thought? Or is it a maladaptive or negative coping skill to deal with whatever it is they're going through? And then, of course, thoughts of death or dying could indicate concern for suicidality. I also want to be cautious of this, though, as well, because some people at times may have intrusive or automatic thoughts about death or dying, and it doesn't necessarily mean that they are suicidal. So again, these symptoms would need further assessment by a mental health professional to kind of rule out some of those things. And I would strongly encourage you to seek support and treatment if any of your children or adolescents are verbalizing that, or if you have concern for those things. So a couple of other signs for concern and possible need for further assessment. Could be changes in eating or sleeping habits. So eating or sleeping too much or too little, keeping in mind as well that adolescents typically need more sleep than an adult, given their developmental stage. Social problems that persist with friends, persist being the key word. So if you notice that maybe your child or teen is having a significant struggle with keeping friends or choosing healthy friends, or they are constantly involved in drama or conflict as a pattern, and you know, no matter what you're trying to support and encourage them to do, they just can't seem to maybe get it. It could be indicative that they just need to, you know, learn some healthy behavior or effective communication skills. But it could also be something greater than that. And so it could be necessary for further assessment. Continuous lack of motivation. So I don't know about you all, but definitely in this past year, I mentioned that I'm also a certified standard school social worker, and I have seen a lot of students struggling with lack of motivation. And some of that has to do with just the significant world events we've all experienced this past year, and some of it could be indicative of a mental health concern. So being mindful of maybe what is typical of your adolescent and what could be considered situational in regards to that. And so hopefully that's making sense. But again, if you have any questions about these things, I'll make sure to answer those at the end. Inability to focus, connect, or control impulses, loss of appetite, changes in personal care. So if you notice that your child or adolescent is really struggling to do activities of daily living, like brushing their teeth or bathing themselves, washing or brushing their hair, those could be cause for concern. Long-lasting, intense, or painful emotions. Again, notice these words are kind of indicative of those factors I was suggesting that you monitor, things like frequency, duration, intensity. Intense worry could be another cause for concern. Increased irritability, anger, or moodiness. Feelings of worthlessness, that's another one that we really want to make sure we're being cautious of, because worthlessness or hopelessness could also be a youth's way of verbalizing that they're struggling with something deeper, something maybe like thoughts of suicide, but they're just scared to say that out loud. And so those are other moods or feelings we want to be cautious of. Disinterest in extracurricular activities or nervous to attend. So if you have a child or adolescent who typically is pretty engaged and motivated and likes social activities or sports or music, and then you find that over, 2 weeks or longer, they are disinterested in the things that they used to enjoy, this could be cause for concern. So again, these are just some signs and symptoms that could be cause for concern and might warrant further assessment. Okay, so I wanted to just touch on some of the common mental illnesses that we see often and that are pretty prevalent in youth and adolescent, because I get a lot of questions about these as well. This first one that we're going to talk about, I want to just be very clear. So ADHD, which stands for Attention Deficit or Hyperactivity Disorder, and it's sometimes called ADD or Attention Deficit Disorder. It's one of the most common childhood illnesses. It's a lifespan disorder. It's something that is continuous throughout the life span, and then I'll talk about some of these symptoms. But one thing I want to share is I get a lot of questions, especially in the school system, because a lot of schools have school psychologists who are able to test for something like this. However, it's not something schools typically that they will just test a child because it's requested. It's typically more common to test in the midst of establishing an individualized education plan, or for students who are in need of special education services. Another question that I get is whether or not a primary care doctor can assess for ADHD. So there are some, without giving you too much information or detail, there are some assessment tools that can be used by a primary care doctor to kind of screen for ADHD. But a lot of the times, and therapists can also assess for this diagnosis, but a lot of the times parents that have shared concerns or questions about this particular mental illness are wondering about medication. And so when we're talking about medication, the only people who are able to prescribe medications are those that have a nurse practitioner license or our doctor. So a primary care doctor is able to do that. And then a psychiatrist would be able to prescribe medications. A therapist does not prescribe medications, and nor does a psychologist. So those are just some questions that come up whenever I've talked about ADHD before. And so hopefully I answered some of your questions if you had any related to that. But so a couple of symptoms to look for if you're concerned about ADHD is if your child or adolescent has a tendency to daydream a lot, maybe they're checked out, they forget or lose things a lot, they're squirming or fidgeting often, maybe they talk too much or really quickly. We call that hyperverbal. They might have difficulty getting along with others, and you see this in younger children, that they just have difficulty getting along with their peers. They might make careless mistakes or take unnecessary risks, have trouble taking turns, and might have a hard time resisting temptation. So similar to the other symptoms, this is not, if you're going through and saying, check, 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 my kid has this, that's not how it works. These are just some common symptoms. They're not all of them. And if you notice, some of these, you might just want to seek further assessment. But in 2016, approximately 3.3 million children aged 12 to 17 were diagnosed with ADHD. And it's helpful to know that severe ADHD can be detected as early as 4, but typically the median onset is 6 years of age. So again, it's a lifespan disorder. It's something that you typically notice from when maybe the youth or adolescent was younger, and can transition to adolescent period and then even into adulthood. And the way that this mental illness presents itself may change based on development as well. So the other thing I wanted to clarify as well is there are different specifiers for ADHD. So sometimes you might hear the terms predominant, they're diagnosed with ADHD, predominantly attention deficit, or predominantly hyperactive. And so that's because when the newest Diagnostic and Statistic Manual of Mental Health Illnesses came out, ADD and ADHD used to be separated, and now they're all under the same criteria. And so they still specify if it's a primarily hyperactive or primarily attention deficit. Maybe too much information, but I just like to specify that. Sometimes the language that mental health professionals use can be confusing, and so I try to clarify some of those things as well. Let me see if there was anything else I was going to touch on with this. One of the things that I didn't put on this slide, but I thought could be helpful, is to talk about some tips for parents. So I get asked this question a lot as a therapist, and then also in the school, is how can we help support our child if we do think that they have ADHD, or we do think that they need further assessment for ADHD. And so some of the tips that I give are to help your child or adolescent stay as organized as possible and try to do things that encourage them to practice following directions, because what that's doing is that's building their executive functioning and that frontal part of their brain that I was talking about earlier. So one example that I strongly encourage is to try and maintain structure and routine as much as possible. This is difficult, especially if you're very busy, but it's encouraged because for children and adolescents who have ADHD, a lot of times they are experiencing like sensory overload. And so anytime they can know what to expect or predict, it can help them be able to manage some of these symptoms a little better. I encourage parents and caregivers to be clear and consistent with rules, expectations, and directions. Try not to overload directions one at a time, or I mean, all at the same time. Try to give directions one at a time, let them complete that, and then ask for something else. And so I know that sounds kind of silly, and sometimes it's just breaking it down and trying to just provide creative reminders or prompts. That sometimes maybe feels like you're repeating yourself 16 times. Try slowing down and just breaking it down into smaller chunks. A lot of times that's a recommendation too for the schools, to try and break things down to smaller chunks academic wise to help children who struggle with ADHD. Trying to think of, let me see if there are anything else. Another big one, and with all of these truly, is to try not to take your children's behavior personally. I know that's easier said than done, but a lot of times as parents we can get overwhelmed ourselves, and so that's why at the end we'll talk about support as well for you. And so one suggestion would just be to try and not take any of the behaviors personally. Try and remember, this is a behavior, and their behavior has some sort of a purpose. I may not know what that purpose is right now, but let me check myself first and then see how I might be able to help further. So I think that's all I want to say about ADHD. Okay. I mentioned in the beginning that anxiety is the most common mental illness. And so one thing that's helpful to kind of know is we can all experience the emotion or the feeling of fear and worry. And so when we're talking about fear can be a response that can be easily identified, that's specific to a perceived, clear, imminent threat or danger. So, for example, if I'm scared and have a fear of snakes, and I'm walking on the sidewalk and I notice something that is coiled that kind of looks like a snake, I may have an initial fear response and reaction to avoid that object before I can determine, okay, because at first my perception is, ooh, that's a snake. And part of that is based in biology as well. But after I'm able to recognize, oh, it's just a tube from a tire from a bike, I might be able to help kind of regulate myself. So that'll be an example of fear. Worry is closely related to fear, but worry is maybe asking a lot of questions, like what if lightning hits the house during a rainstorm, or what if I break my arm during practice, or really just kind of a lot of worry about random things. And anxiety is similar to worry in the fact that it's also anticipatory, like worry, but it's also often focused on a possible danger. So unlike worry or fear, anxiety is more intense. It's overwhelming sense of unpleasantness, discomfort, or apprehension. And again, talking about frequency, intensity, duration, and functionality. These feelings can sometimes be related to a specific thought or feeling, but oftentimes a child or adolescent can't explain why they have such worry or fear about this specific thought or feeling. So a child or adolescent living with anxiety may refuse going to school, have difficulties at school, seek reassurance on that everything will be okay. So if you notice that your child or adolescent is constantly seeking reassurance or asking, is that okay? Or is that all right? Or what do you think about this? It might be suggestive that they're struggling with some anxious thoughts. Anxiety's best friend is avoidance. And so one of the biggest symptoms of anxiety we see is avoidance of specific things, situations. Examples could be crowds or dogs. And so that's another thing to kind of be mindful of and monitor. Children and adolescents also might experience difficulty sleeping or eating. So anxiety can also create what are called somatic symptoms or physical body symptoms that impact their digestive system, or even, they might have headaches often or stomach aches often. And this may be anxiety presenting itself in the body. They might have difficulty handling minor problems and have difficulty with the separation of parents. So some of these symptoms are specific to a specific anxiety disorder. So as I mentioned before, these are not all inclusive. And if you are going through and think that your child or adolescent has all of these, it does not necessarily indicate immediately they are struggling with an anxiety disorder. So, but one thing to note is that anxiety disorders affect 25.1% of children between the ages of 13 and 18. And research has shown that untreated children are at higher risk of performing poorly in school, missing out on important social experiences, and engaging in additional risky behaviors like substance abuse. Similarly to ADHD, I'll talk about some tips for parents that might be concerned about anxiety. I know here in the last year, there's probably going to be a significant increase in anxiety-related disorders, just given all of the things that we've experienced collectively as a community. But generally, worries and fears that cause significant distress or impairment in functioning might be an indication that your child or adolescent is struggling with anxiety. And I hear someone moving around, but I just wanted to make sure there wasn't any question or anything. Okay, so some tips for children and adolescents who struggle with anxiety, especially if they're having distorted or negative thinking patterns. One thing to kind of keep in mind is that critical feedback can be really difficult for them to receive, and it could also increase anxiety. So trying to avoid being overly critical is suggested for those children and adolescents that might struggle with anxiety. I talked about the seeking reassurance, and so if we're critical for those children that are struggling with that, it could cause further concern. Another thing that I see frequently in the schools is high performing students can also struggle with anxiety. I've worked with some patients both at Copper and other places where children and adolescents who are really high performers tend to have perfectionistic thinking patterns and maybe struggle significantly with anxiety or fear of what if I don't get an A. And so it can be really kind of debilitating too, so much so that it's impacting their ability to function in other areas of their life. That maybe, they're chronically overstudying or chronically stressing or worrying or anticipating failure. So that's another thing to keep in mind. Praise and reinforcing effort can go a really long way. So I really encourage parents and caregivers to use praise and reinforce effort rather than perfection, things of that nature for anyone that might be concerned about anxiety. And then
Megan, can you maybe touch on real quick, like school refusal because of anxiety? We actually had somebody mention that in the chat, and we do see that a lot at the school, that their anxiety affects their ability to even attend school. So what would you suggest for those parents?
Sure. So, like I mentioned before, all behaviors have a purpose. And so one thing that I would suggest is maybe trying to get to the root cause of the refusal. Some children and adolescents can't speak to why they refuse to go to school. Sometimes currently it's related to a fear or anxiety about getting sick, about having COVID or contracting COVID or the spread of COVID. And so sometimes if it's related to that, which some students I've worked with or patients even, we've talked about increasing their sense of safety. So a lot of times with anxiety, it's anticipatory and it's also perceived fear or worry. That doesn't mean that it's not valid. It just means if you can do things to affirm that there are practical, logical solutions to increase their sense of safety. So for instance, if your child is struggling or refusing to go to school because they're significantly concerned or anxious about COVID, maybe helping talk to the school that they go to in regards to explaining to the student or child what safety measures are in place. Where can they go if they start to feel overwhelmed or anxious at school? Who is a safe adult at school that they can talk to? Because as I mentioned, avoidance is anxiety's best friend. Avoidance is easy short term and it gives that relief short term. But what happens long term is that it ends up enabling that behavior of avoidance, and we never really are able to work through whatever that fear or anxiety is. And so gradually exposing, and I don't recommend that you do this on your own, work with a professional at school or with a therapist, doctor, but gradually exposing a person to what they're anxious about or fearful of can help decrease avoidance and increase effectiveness of the behavior you're trying to change. So that was kind of a long-winded answer, but hopefully that gave some insight. It's kind of vague because there's no like hard and fast black or white answer. It could be very personal to that particular child that's struggling. But COVID is one reason. I know a lot of students and adolescents have struggled with refusing to go to school. Another one is a lot of students, unfortunately, I don't want to say a lot, but some students unfortunately experience social difficulties or peer difficulties. And so they may refuse to go to school to avoid having uncomfortable interactions with their peers or with their teachers. I have another patient that I've worked with in the past who was fearful of just being told flat out no from their teachers. But this was more of a what we call a fortune teller error, where they were just really anxious and had a distorted thinking pattern, believing that even if they asked for help, they knew for sure that their teacher was going to say no. And so being able to work on those things in therapy is one way to help with refusal of going to school, but also as a parent, really just trying to partner with the school, partner with your child, ask questions if you can about why they're feeling so strongly about not going to school. How can you help them maintain their attendance at school, and just kind of going from there. So especially with adolescents, they really need, I mentioned earlier, a typical healthy behavior is the need for independence. And so I know this is kind of hard to do. You want to make sure you're maintaining, prudent protective parenting, but at the same time, if you can offer up a choice or involve your child or adolescent in the process of whatever it is you're trying to do or whatever behavior you're trying to change, you're going to get a lot more effectiveness if they are involved, because they want to have a voice, they want to feel heard, they want to feel they have some sense of control, even if it's still control that we have, if that makes sense. So hopefully that answered the question without having specific examples of refusal for school. And then don't minimize feelings too. The other thing that I like to talk to my patients about, and families and caregivers as well, is, we have thoughts and we have feelings, and whatever we're thinking and feeling are valid, but it doesn't necessarily mean that it's true. And so sometimes I'll say to my adolescents, don't always believe what you think. Our mind can play tricks on us. Our feelings can, make us go from our rational, logical mind to our emotion mind, where we're not thinking very clearly. And so it's helpful as a parent if you can still validate that they're having a hard time and that they're experiencing a difficult emotion or having a difficult thought. In that moment, don't try to change their thought or feeling. Just let them know that you're there to support them and that you want to be able to help them, and ask, what can I do to help you right now? And a lot of them will say, I don't know. That's okay. But at least offering that support can be helpful. Okie doke. And then let me see if there's any other tips on here. So I mentioned that some of these symptoms too that are here are specific to anxiety related illnesses. And so again, without giving you too much information, I'm just going to briefly touch on the different anxiety disorders. All of these are relative to the person in the sense that each person may experience, or each person may have a different presentation for these kinds of things. So I'm not going to jump into each of these disorders. When I was talking about anxiety, it was more specific to generalized anxiety disorder. But it's also helpful to know that there are other symptoms that could be indicative of things like social anxiety disorder, specific phobias, which is having a specific fear of something. And so, like I mentioned earlier, which I don't like spiders, actually, not snakes, but if I had a significant anxiety and a specific phobia of spiders, that would be something that could be worked on in therapy. Obsessive compulsive disorder has a component of anxiety. And so that's a whole other beast. I'm not going to dive too deep into that, but and then panic disorder. So one thing I want to say, panic disorder is different than having a panic attack. Again, there are different diagnostic criteria that have to be met to get this particular diagnosis. However, you can have it, something such as generalized anxiety disorder with panic attacks. And I say this because there's a lot of patients I've worked with and students I've worked with who do experience panic attacks, but they may not meet diagnostic criteria for panic disorder. So I just like to differentiate that. And again, I'm not going to jump too much into this, but I just want for you to be aware there's all kinds of anxiety related disorders. And so if you're curious and concerned about your youth or adolescent, to try and get further assessment, really pay attention to those intensity, frequency, duration, and functionality factors that I mentioned in the beginning. Talk with your child or adolescent about their thoughts, their feelings in relation to anxiety, to try and help gather information to be able to present to a mental health professional in the initial assessment. And I'll talk about that when we get to the treatment part. Okay, moving on to depression. As it says here in the slide, the tricky part about depression in children and teens is that it can be marked by periods of typical adolescent behavior. So I mentioned earlier in that big blue bubble of healthy behaviors, typical adolescent behaviors, that increased moodiness can be typical. We know that they're growing and developing and hormones are changing and shifting. And so moodiness in general can be a typical adolescent behavior. The other thing to keep in mind too is even a child or adolescent who can appear very happy, this can actually be mistaken for temporary sadness. So basically what I'm trying to just suggest or say in this slide is just, I have had a lot of people say before, oh, well, they don't seem depressed or they don't act depressed. And sometimes that can feel very invalidating to the person who's struggling, because we all want to present our best self, and we all try to present our best self. And so somebody who struggles with depression, if they are not in an active depressive episode, they may appear to have some happiness or contentment, but that does not mean that their illness has gone away. Maybe they are managing their symptoms appropriately, or they're in a space where they're able to kind of tolerate their depressed mood in a way that presents itself as contentment. And so another thing to keep in mind, and I'll touch on this in the next slide, is that symptoms of depression can vary between girls and boys. And so I'll get a little bit more specific in the next slide, but some common signs and symptoms of depression can be things like frequent sadness, tearfulness, crying. Also increased irritability, anger, and hostility. And this is actually something I meant to talk about as well with anxiety. Especially in adolescence, anxiety and depression both specifically can present very commonly as irritability. And so that emotion in and of itself can be typical, but can also be indicative of depression or anxiety. And so again, thinking about duration, intensity, frequency, and functionality. Decreased interest in activities, inability to enjoy previously favorite activities. I talked a little bit about that. Poor concentration, feelings of hopelessness or helplessness or worthlessness can be signs of depression. A major change in eating or sleeping patterns, persistent boredom or low energy. And so, one thing that's really difficult nowadays, even from when I was in high school, that's changed significantly, is that children and adolescents don't know how to be bored. And sometimes it's okay to be bored. But if it's something that's persistent and it also kind of coincides with low energy or low motivation or decreased interest, then it could be more than just boredom. Talk of or efforts to run away from home, that can just be a sign of escape. That's all I'll say about that one. Social isolation or poor communication, thoughts or expressions of suicide or self-destructive behaviors, difficulty with relationships, low self-esteem, and feelings of guilt or thoughts of shame or feelings of shame or guilt. And then extreme sensitivity to rejection or failure. So you may notice that some of these symptoms overlapped with other mental illnesses. And so one thing to note is that not always, but it can be common for depression and anxiety to be comorbid, which just means that they can coexist. You can have anxiety and depression, and they are two separate illnesses, but you can have both. And actually, it can be common to experience symptoms of both diagnoses and illnesses. Let me see what else about depression. The other thing to keep in mind, I've heard this a lot before too from families that I've worked with, is that a lot of times the perception is that their child or adolescent is lazy or careless or thoughtless. So again, trying to tease out the difference between typical adolescent behavior, right? Sometimes we may have a child or adolescent or even an adult for that matter that wants to be lazy or doesn't have motivation to do things or is maybe thoughtless or careless. But again, if we're thinking about the frequency, you are going to be like, this lady is a broken record. But the frequency, intensity, duration, and impact on their function can determine whether it's something to be more concerned about. So another cool thing that I forgot to mention when I was talking about ADHD, a lot of people aren't sure where to start with reaching out for mental health help. Most primary care physicians are able to write a referral for therapy or counseling. And so if you have a really strong connection with your family care provider, I encourage you to talk to them, ask for referrals for mental health treatment, reach out to the family doctor, let them know you want to get involved with a therapist. That's something I meant to say earlier and just wanted to make a lot of you aware of, because sometimes it feels overwhelming and you're not sure kind of where to start if you do need help. And I might be jumping the gun there, but so some other suggestions for children and adolescents that you might be concerned about with depression would be to reach out to the school to see if they can also offer support. This year specifically, we've again seen an increase in depression and anxiety given all of the things that have happened. And so it's really important, and I strongly encourage parents and families and patients that I work with to collaborate with their school, because they spend the majority of their time at school during these years. And so it's important and helpful for them to know where can they go if they need support at school. Who is somebody that you may want to keep or like make aware of their difficulties. A lot of times a good place to start is with their school counselor. Some school districts and schools have a designated social worker who is very well versed in these things and can help link to service referrals if needed, and also provide support. So talk to your child's school, reach out and let them know that they need support. And then also in regards to things like changes in sleep or eating, similar to what we were talking about with ADHD, is try to encourage healthy behaviors in those areas. So give give choices, offer healthier habits for eating, encourage a sleep routine. Maybe you do it together as a family. You all want to get more sleep, and then try to encourage healthy behaviors, exercise, things like that. All of those things can increase all the good neurotransmitters in our brain that can help fight depression. Okay. So the next slide. Oh, and I also just want to say too, some of the things I used here are clip art. So I just, as a therapist, I want to be sensitive to any misgendering and just say that I did not create these little emojis. They're clip art for male and female, but and that's all I will say about that. It's no means to be rejecting or forgetting other people who identify differently with their gender or identity or sexuality.
Hey, Megan, just to give you a heads up, it's 6:56, so we'll probably take questions about 7:15. So just to give you a heads up on that.
Thank you. So a couple of differences though to kind of just point out. For adolescent boys or young boys, they might show morning fatigue. Their self-harming behaviors might be things like cutting or burning. They might be more aggressive in their behavior or get into fights or pick fights if they're struggling with depression. A lot of times because society can kind of project that anger can be a really powerful emotion. And so sometimes it's easier to feel angry than it is to feel depressed. For adolescent girls, they could feel strong emotional guilt, self-blame, failure. They might struggle more with negative body image, withdraw from family and friends more, be more promiscuous, or have difficulty with weight loss or gain, and have frequent crying. The other thing I forgot to mention with self-harm, there are lots of different kinds of self-harm. So if anyone has questions about what is self-harm, aside from just cutting, I know I mentioned on the side burning, I'm happy to answer questions about that as well. Okay, so, and I actually might finish a little before 7:15, so then we'll just have more time for questions. So reaching out for support. Reaching out for your child's mental health support may be the single most important parenting role you assume for their long-term development and health. So here are some good ways to start. And these are just some tips kind of that I've touched on as I've presented, but talk to your children. The best way to know what's going on is to check in with them on a regular basis. Model for them that, you know, life is hard. It is hard, and it's okay to not be okay, and that we struggle even as adults. Again, I talked earlier about presenting our best self, but sometimes it's helpful for children to see and adolescents to see, you know, how we go through our own struggle and can manage and cope with those things, right? I am in no way suggesting to tell your children or adolescents all of your problems, but if you can model healthy coping for your children and talk to them about some of the ways you've dealt with your struggles, it could be helpful. Keeping in mind too that we all deal with things differently, but talking to your children, opening that door for communication, letting them know that there's nothing to be ashamed of, and there's nothing wrong with talking about mental health and mental illness, even the dreaded S word, the suicide or self-harm word, giving them the opportunity to be honest with you. Spend time with your kids. And what I mean by this is try to be 100% present. We live in such a fast-paced world, and oftentimes we're all multitasking, or we don't have the opportunity to truly be mindful or present in the here and now. So carve out some time, schedule some time to have no technology, no distractions, no multitasking, to really just be present in the moment with your kids and adolescents. Be patient. Remember to be patient with yourself and your children. Remember to not take things personally, especially when we're talking about behaviors. Of course, easier said than done. And take care of yourself. This is huge. I often get a lot of questions and laughs about this when I work with families, because it's often the same, like, you know, I have 3 kids or 4 kids, or I have a lot of children and a lot of things, and I work full time, and like, when do I have time for myself? Similarly to taking care of your child's mental health, it's so imperative that you're also looking after yourself. And because if you can't pour from an empty cup. So if you are modeling for your children and adolescents that you are able to carve time out, this can be a huge role model for our kids and adolescents, and that can be the biggest indicator of how successful they are or who they become as a person. Take breaks when you're overloaded or frustrated. I like to say tag in another adult if you have one, or maybe even an older sibling if they're able and have a good relationship with their sibling, to just kind of distract them in the moment, right? I'm not talking about making the older siblings create discipline or consequence or anything like that, but give yourself a break if you need to, push pause on conversations if needed to revisit at a later time. So this is just some ways that you can support before actually reaching out for treatment. But this is just some suggestions for being supportive of your youth as a parent or caregiver. Okay, reaching out for treatment. I mentioned earlier that there is a significant delay between the time that symptoms can present themselves and when people typically seek treatment. That time can be 8 to 10 years. That's an average delay between the onset of symptoms and getting treatment. And so I said this earlier and I'll say it again, early intervention can help develop important coping and adaptive skills that can allow for them to thrive socially, emotionally, academically, and physically. I love this statistic. It's really awesome. 80 to 90% of people who get treatment see improvement in their symptoms. And so that's the other thing to keep in mind. When we're talking about diagnoses or mental illnesses or conditions, they're just big fancy words for what symptoms are you experiencing? What concerning signs are you dealing with? And how can we treat those symptoms? How can we learn to manage and cope with those symptoms? Many of the mental health or behavioral problems that children struggle with can be effectively treated with evidence-based therapies. So some mental health professionals that you and your child can seek out include clinical therapists like myself, counselors, school psychologist, clinical psychologist. Another example I mentioned earlier was a psychiatrist. They typically don't do therapy or counseling, and they primarily focus on medications. So that's just something to be mindful of as well. I love this graphic. This is talking about how mental health, I mentioned earlier, we all have mental health, is a continuum. So I like this because it talks about essential life functions. When I was talking earlier about, noticing functionality, are things impaired? Maybe you notice social impairment in their ability to perform or to form and maintain healthy relationships, or academic or work-wise, they're, unable to achieve appropriately because they're so anxious or depressed that they're not able to get their work done. Maybe they're overeating or oversleeping in their daily activities. And so I like this graphic because it also just shows the difference between mental wellness and mental illness, and that it's on a continuum. So some mental wellness factors, I mentioned earlier, mindfulness. To be mindful means to simply be present in the current moment, in the here and now, not worrying about the past or the future. Mindfulness is an evidence-based skill and treatment. A lot of the schools are implementing mindfulness rooms or centers and skills. And actually there's a whole agency called Mindful Schools. So check them out if you're interested. Having a supportive family life can be indicative of mental wellness. Being able to go to psychotherapy, which is just a big fancy word for talk therapy, which is most traditional therapy. Medication can help with mental wellness, healthy lifestyle, physical wellness, safe environment. On the flip side, things that could be impacting mental illness or factors of mental illness could be brain chemistry, family history, genetics, family stressors or situational stressors, traumatic life events, unhealthy lifestyles, physical illness, substance abuse, social or cultural expectations, and unsafe environment. Okay, so I talked a lot tonight, and I talked a lot about just what is mental health, what is mental illness, what are some of the common mental health conditions or mental health illnesses. And now I'm going to talk a little bit about our program. And so I am the Copper Springs Adolescent IOP, which stands for Intensive Outpatient Therapist. And I work full-time as a school social worker, but I am part-time at Copper Springs. And so I say that because a lot of times I'll get, I'm going to share my contact information, but I'll get questions and I might not be available right away. I try to check that as often as possible, but I just want to be honest about my availability. But so with Copper Springs, the Adolescent IOP program, there is another adolescent therapist as well. We are working on splitting up our groups to be able to have 2 groups that are from 13 and 14-year-old would be one group, and then 15 to 17-year-olds. And the reason for that is because not just chronologically, but developmentally too, a 13-year-old and a 17-year-old can have significant differences. And so we're not looking to split up solely based on chronological age. During the initial assessment too, we're assessing for developmental, social, emotional age to determine what group they might be a better fit for. Our groups are 3 times a week for 3 hours a night. So this is about 9 hours of therapy a week. It's intensive. I say that because I've gotten a couple patients who start out in our program and have never done therapy. They do really well, but they also recognize, wow, this is a lot. And so it's great because you're able to make a lot of progress in maybe a shorter amount of time because of its intensity and frequency. But sometimes that's overwhelming. And so I just like to be transparent about that as well. We do take small breaks in between our group sessions as well, anywhere from 10 to 20 minutes. And that's dependent on the conversations we're having and the topics we're discussing and where the group is at. I get this question a lot too. The program is approximately 8 weeks or 24 sessions, but this varies according to individualized needs. I've had patients who have successfully completed the program or met their treatment goals, I should say, anywhere from 4 weeks all the way up to 8 weeks, and sometimes even extending into 10. And so I mentioned 2 therapists, myself and then Amber Kaufman. She's also a licensed master social worker. And some of the evidence-based, which just means that they're backed by research, they're effective modalities and interventions that we use are cognitive behavioral therapy. This is focusing on the connection between thoughts, feelings, and behaviors, and also working to reduce or reframe negative or distorted thinking patterns. Dialectical behavioral therapy, which is great because it's primarily based around skills. One disclaimer about this is I love DBT, but this is our program and my group is not DBT like if it's a specific DBT only group. I say that because this is a pretty specific treatment modality. And so while I'll pull and I'm trained in DBT and I can pull from skills and use some of those skills, it's not structured in the way that a traditional DBT only group would be. Group therapy is what our program is. I've had anywhere from 2 to 8 adolescents. We cap it at about 12 because then it gets a little much for one therapist and also for the adolescents to have that many peers in a group. And then psychoeducation as well is increasing knowledge and insight in regards to mental health, mental illness, behaviors, skills, those kinds of things. So, I don't think I forgot anything there, but if you have any specific questions about our program or other questions about the treatment modalities, let me know. And so this last slide actually is the question slide and my contact information. My email is there. I work remotely and part-time, as I mentioned. So the phone number that is there, it goes to our outpatient intake or assessment line. And I believe it actually goes to our outpatient manager's desk, Lauren Seawald. But it's a good place to start, and it will direct you to where you need to go if it's after hours. So yeah, I think that's all I need to speak at you. So I cannot, let me see. I wonder if I should stop sharing my screen to be able to see everybody.
Yeah, that's great. And we've got a couple of questions in the chat box, and then I think somebody raised their hand. So
I just want to make sure everyone has this contact information, but I know you said you'll share the PowerPoint. So is everyone good if I stop sharing now?
Yep.
Cool.
Okay, so we're going to open it up for questions. So if you have questions, feel free to ask out loud or type it in the chat box and we'll read them. Okay, so one question in the chat box, Megan, I don't know if you can see that. It says, why do an IOP versus a DBT group that meets weekly over the course of several months?
Why do an IOP versus, okay, so dialectical behavioral, I think I understand what this question is, but dialectical behavioral therapy, again, like I mentioned, is a specific treatment modality similar to something like trauma-focused cognitive behavioral therapy. DBT is specific to patients that maybe have seen limited or very little progress in any other treatment. And so DBT was created by Marsha. I'm trying to think of how much information to give you without nerding out on you. But Marsha Linehan created this treatment modality. She herself is diagnosed with a personality disorder. And so a lot of this treatment modality is geared toward those who have significant mood-related disorders, things like depression and anxiety, but also those who struggle with personality-related disorders and who have not seen any other improvement in other treatment. And so it's great if you're looking for a skills specific group, but it also, I caution you to just throwing in a child or adolescent straight into DBT if you've never tried something else, because it is very structured. It's very specific. It's mostly skills based. And so if you have a child or adolescent who has never done therapy, chances of them wanting to engage in an all skills based modality is probably not very likely.
So she says more intensive short-term versus group therapy long-term was more her question than modalities.
Oh, okay. Sorry. So I don't really know that this is like a personal choice, to be honest. There's not, I think for those people who are struggling significantly with intrusive or intense depression, anxiety, suicidality, self-harm, you want to have a more intensive, frequent treatment rather than like a long-term weekly treatment. And so one of the ways to kind of think of this is if a child or adolescent goes for an inpatient mental health assessment, okay, say for instance it's life-threatening and your first go-to is to contact 911 or to get your child assessed, and they go into a mental health hospital. Typically what happens is when they're released, they have like a step down process where maybe they'll go either partial hospitalization or PHP program or an IOP program, because the idea is to try and trickle down. And so when I talk about intensive therapy, it's just in regards to the frequency and treatment. So again, I don't know that I really did that probably the way you're hoping, but it's decision or choice. So I'll leave it at that.
Okay, another question a parent asked was, does Copper Springs have psychiatrists available if medication is needed?
Yeah, good question. And I totally forgot to mention Dr. Kramer. So thank you, Helen, for asking that question. We do have a child prescriber who oversees patients in the program. However, it's important to note that he is not an ongoing psychiatrist. So once the adolescent would complete our therapy IOP program, the suggestion and recommendation would be to find an ongoing psychiatry provider. And so he's willing, and I'm more than willing always to get connected for patients and families after the IOP is finished. Okay, good, Tammy, because I was like, I'm super vague sometimes, and I didn't know if my answer was answering your question effectively, so I'm glad that was helpful. Cost of such programs. Good question, Rachel. I do not work in the business office, so I will shy away from answering this question. What I do know is that we take a lot of commercial insurance. We also... I know in our business office, if you have specific question about costs, I would encourage you to just call and ask to speak to someone in business office. They would be more than happy to kind of go over financials with you, but I don't see any of that. And so I have no idea. And it also would be personal Yes, struggle to find plans that use your insurance. I know that I would suggest calling and talking to your business office. I don't want to say anything that could get me in trouble, so I'm not sure. But I know that there has been certain circumstances that we've worked with families on before. So give us a call and ask to speak to someone in business, and maybe they could go over financials with you. I know, and that's such a difficult thing, and I hate that that's ever a barrier. It should never be, but it's an unfortunate reality. So one program I heard of today, I don't know if you all are familiar with this in the Chandler School District, is Lalo Boy Foundation, LALO. They actually do stipends for counseling and therapy. I don't know. I just learned about them in our mental health youth collective meeting today. So maybe check them out too to see if they, I don't know what their requirements are for stipends, but they may be able to help assist financially as well. I don't know. There might have been some questions. I couldn't see any of this chat when I was presenting.
Anybody else have any questions?
I saw Jen ask a question earlier about her daughter specifically. Jen, she said she's going to a therapist. I don't know what the ins and outs are for that. I would suggest having a family session to discuss possible barriers or see if the therapist has insight into what's going on or some suggestions for decreasing the refusal of school.
Hi, I have a question.
I don't know who I is, but go ahead.
Oh, I'm under Nicholas. That's my son's name, actually.
Perfect. Okay, hi, yes.
Are there groups at the schools that kids can get together and maybe kind of, I don't know, confess these things to one another and kind of find some kind of reassurance that they're not the only ones that are feeling these things?
So I can only speak to the school I work for. So that would be a question for the school site specifically. But I do know that a lot of schools are putting a lot of effort into building, whether they're peer support groups or skills-based groups, because this is something that's really common. So I would say ask your child's school directly. I know we have a skills group that I run at our school. But one thing to keep in mind as well is sometimes these groups that are at schools are not a replacement for therapy or treatment.
Sure.
They're rather just kind of
just to augment, sure.
Yeah. Yes. So ask your school.
Okay.
I know our school definitely has those.
Okay. All right. We'll ask. Thank you.
Most schools do. I'm not sure what school your guys is. Is it for your son?
Yes.
What school does he go to?
Well, he's currently splitting from Chief Hill Learning Academy and Perry High School.
Okay. So I'm the social worker at Perry, so I'm happy to put my information in there. I do run a couple support groups.
Oh, very good. Okay.
Yes, one is on stress and anxiety, so we can chat more.
Okay, great. Thank you very much.
Yeah, I think you might during her game.
And then Olivia, okay, so Helen asked earlier, what about constant apologizing? I'm guessing that was maybe when I was talking about anxiety. Yes, constant apologizing could also be indicative of anxious thoughts or anxiety. Olivia put bullying ? But I'm not sure what you're asking. I don't know if Olivia is still on here and wants to clarify.
I think that was relating to the student not wanting to go to school and having some anxiety due to bullying.
Sure. Okay. Yeah. And I hesitated to even talk about that because that could be a whole other topic of discussion. But a lot of times too, we know that peers and adolescents sometimes can just be plain mean, but it can be, if it's a pattern of behavior, it could rise to bullying. And so that absolutely could get a child develop anxiety or have concern or want to refuse.
So to answer the Basha High School question, I'm the social worker there. We have been doing support groups for anxiety, stress, and depression every quarter this year. So we've had 2 every quarter. Next year, I'm hoping to add some more besides just the anxiety, stress, and depression, but it's been pretty good so far. And I have all different grades. So usually it's split between 9th and 10th, and then the second group would be 11th and 12th. So just email me. I could put my information too.
And I know Tammy said, what's your website? Like our Copper Springs website? I probably should have put that in the PowerPoint.
I did share the Copper Springs website, if that's correct, Megan.
Yes. Yeah.
Got it.
So that's locations for the Gilbert. Just if you're looking for that. So when you go to the actual just Copper Springs homepage, there should be a whole separate tab for like if you look under services, it will say Adolescent Virtual Program. Because even though it's virtual, it's based out of Avondale. So if you have difficulty finding it, it may not be at that Gilbert location. But yeah, you should be able to find the tab there.
I just reposted it with that tab specifically, Megan.
Perfect. Thank you so much. How can I encourage my child to a therapist? Good question. I did not say this, and this is super important. So I'm bummed that some people signed off, but the biggest factor recovery and more important than any treatment modality or intervention is the relationship that a therapist and a patient is able to build. And so what I mean by that is, I don't know, Francis, I don't know your child specifically or how long they've been in therapy, but one thing that you could always encourage them to do is to try to encourage your child to just share surface level information. Let their therapist know that they want to just kind of build more trust, be able to talk more about things to get to know each other. Sometimes it's hard as a therapist to spend time rapport building because we want to be able to treat the presenting problem, right? But one thing that sometimes we can forget, as we're still first, is that some children take longer to open up and to build a relationship and to earn trust. So I just encourage you to talk to your child about maybe why they don't want to open up to their therapist. Is it because they don't feel safe, or they don't feel they can trust the therapist, or they want to get to know them more? Or is it something simpler, like they just feel more comfortable talking male or female, or somebody who's younger? I mean, it could be a whole bunch of reasons. So I would just ask your child maybe what's preventing them from opening up in therapy. When searching for providers, does it matter whether therapists? I get this question a lot too. This again too can be a personal preference. One thing I might try to share with Lindsay or Nicole or whoever is there's this really cool resource that breaks down the difference between a therapist, a psychologist, a counselor. A lot of times it has to do with educational background, what their degree is in, and also what work experience they have. So for me, like by my license, I am a social worker, but I'm also a therapist. And so there's a lot of confusion, I think, in mental health terminology. And so I can't remember, I think it maybe came from SAMHSA. I can't remember, but there's a resource that I have saved that I don't have right with me, but I will send. But you could also do a quick Google search, like what's the difference between therapist, psychologist, counselor? And see if something pops up there. So this is, again, a personal preference. If you are having a specific concern or issue, for instance, I mentioned earlier, I'm a certified clinical trauma professional, excuse me. So if you have children or adolescents that are struggling with a specific area of concern, like trauma, you might want to look for somebody who is educated or has experience working with trauma. So hopefully that answers that question. Oh, and Francis, I'm sorry to hear that. Yeah, they haven't started yet, but they won't talk to us. I'm curious to know maybe why they say they won't talk to you. And by they, do you mean your child or the therapist? Because it could go both ways. Your child, okay. Yeah, again, these are topics that are really hard for anybody to open up about, but especially children and adolescents. And so I would just encourage you to be patient and just give them the opportunity, keep encouraging them, keep telling them that you're there to listen, that you want to support them, you want to know how to help them, and hopefully it will change. Okay, I don't see any other questions in the chat. Yeah, you're so welcome. I don't think I see any other questions. Did I miss anybody? Are there any other questions, comments?
Did you address the one where there was a few questions earlier when we were talking about the refusal for school on on constantly apologizing? Did you?
Yeah, I think that's when we were talking about the anxiety slide.
Yes.
Mm-hmm.
Yeah.
Yep, I think I did that. Yeah,
Okay. Well, I think if there's no other questions, I will be emailing out the presentation to parents and posting it on our website. I know Basha will as well, and CUSD also posted on their main site. So you can access this information all over. Nicole, do you have any final thoughts?
No, I don't. Thank you all for coming tonight and attending.
Yes, thank you, Megan. We appreciate it. That was wonderful.
Yes, absolutely. I'm glad to help. And if anyone has any other program questions for Copper Springs specifically, please reach out to us. We are more than happy to help and willing and would love to work with the children and adolescents and families. So, and I'm glad that I got to do this. Now you know me. So I'm the one that runs the program. So, you know, don't be a stranger if you have questions.
Great. Thank you.